guys, we're talking about everything screening today, right? That's the plan?
Yes, everything. I think this is such a huge hot topic I get all the time from patients because stuff keeps changing. I love that we're covering this today.
Oh, sorry. I was saying, Dr. Aragona, do you want to introduce yourself to the Fem Health audience?
Sure. My name is Dr. Erika Aragona. I'm a board certified family medicine doctor, but I specialize in women's health. So almost all of my patients, clients, consults, I kind of tend to say that MDs do the same thing, right? I mean, I love bridging the two together. We really focus on mind, body, spirit as a whole. All doctors do. So what my goal is to prevent disease before it starts. So the reason I think this topic is so important is because I practice it every single day. I'm a faculty member at the local medical school where I teach women's health, and I specifically educate medical students on the importance of screening exams. And we're going to go into more detail for everyone watching about what that means. But the biggest impact is we want to catch stuff before it spreads, right? We want to catch things before it goes to other areas of the body. My job as a doctor is to try to treat a patient their entire body, head to toe, but keep them at their healthiest. Right. Screenings make a big, big difference. I do a lot of talking online and on my website, drerika.com, about female empowerment and enrichment. And I'll tell you, the physicians that I have met who are making the biggest impact also have really strong voices in educating women on what they need and why. Because I think a lot of the time it's missed. We hear diabetes, hypertension, high cholesterol, or whatever, bad diseases. Well, what about just prevention, skin checks, breast exams, things that make a huge difference in day-to-day lives for women all over this country and all over the world? So that's what I focus on. That's what I love to do. That's what I'm doing today in office.
That's awesome.
I've done today and am going to do in just a second.
That's great. So do you want to talk a little bit about, like, from youngest to oldest, maybe starting, what do we need to worry about, in our 40s, 50s, 60s? Because, you know what, even though we're doctors, we forget the age when you start. People ask us all the time. So I think it's really important to just lay that out there.
Yeah, and the other thing with that, and I love that you mentioned that, is it's always changing. So even as doctors, we have to keep up to date on when screening guidelines change and why. Because a lot of times I get asked, hey, can I have all of these tests done and people aren't eligible? We have to be able to explain why those guidelines exist and not just say, well, you can't have it yet. Everybody has different variances and people are not textbook. And I try to drive that home with my patients. These are the guidelines for a reason. We know that if certain cancers are more prevalent at certain ages, that's when we want to start screening before it starts. But there's always someone who could have something develop earlier or later in life. So if you have a patient, before we get into all of the guidelines, I really want to drive this home. If you listening out there have a question about your health and you don't fit these guidelines we're talking about, go see your doctor, right? Like, that's the most important thing. If you have symptoms, you have concerns, everyone is different. You're not black and white. There's so much importance of your personal health that ties into why we do what we do. Okay, so let's talk about the guidelines, because this is a huge topic. I teach my students all the time about it. It's on our boards. We have to memorize it. You know that from both of your experience. USPSTF, what does it stand for? So United States Preventive Task Force Service, okay? You guys can all look it up. Everyone listening, you can go to that website, uspstf.com, and you can see the guidelines that I'm referencing with explanations on why they exist. But in a nutshell, what it does is it takes huge studies from across the board of colon cancer, breast cancer, skin cancer, cardiac disease, and it will look at people who are at risk: age, gender, ethnicity, demographics, family history, and then they will recommend what age we start, how frequently we perform, and what age we stop these screenings, so doctors have a really good basis of a guideline to follow. Then we take into consideration everybody's unique experience when you're in the office. That's where it's really important to advocate for your health and say, hey, you know what? The guideline says this, but can I do this because of X, Y, and Z? That's where your doctor, knowing your personal history, comes into play. So we start screening usually age 21. So if we're going to talk about cervical cancer, the interesting thing there is the American Cancer Society estimates about 14,000 new cases are going to be diagnosed in the United States in 2023. 14,000 cases of cervical cancer. That's a big number. But what I think is really, really cool is, where did I put it? Oh, cervical cancer used to be one of the most common cancers of cancer death, actually, for women in America before we implemented screening. So even though 14,000 sounds like a big number. It's been dramatically reduced because we start doing pap smears. So we normally recommend starting a pap smear at age 21 and every 3 years through age 29, as long as your pap smears are normal. I'm only going to talk about the normals here because otherwise it's a really long list. But if it's a normal pap smear, and again, that's a pelvic exam that your doctor would perform, and they take a sample of your cervix testing for abnormal cells. And then if it comes back concerning, they'll tell you when you need sooner follow-up. Otherwise, every 3 years. We want to start at that age. And right now, we're still saying, regardless of sexual activity, regardless of other risk factors you may have, we don't need to start earlier than age 21. Now, the cool thing is we developed HPV testing, and I've actually done a video series for Femme Health on this. So any of you watching, you can actually go back and watch the videos that we've talked about this in more detail, and certainly send messages here in comments if you have questions, because I would love to fill in any answers you have after this podcast and session. But HPV testing, human papilloma virus, has been linked, certain strains, to cervical cancer. And after age 30, the likelihood of that turning in to cancer if you have HPV is higher. So we will screen every woman starting at age 30 for not just that pap smear I was talking about with the cells, but also for the virus. And if it comes back normal, yay! The cool thing is you don't need another one for 5 years. I get a lot of questions about that. Really? I had to do it every year. I had to do it every 3 years. You know, you don't have to do that. So if it's normal, we can do it every 5 because the testing has evolved, has improved, and is a better predictor of possible cells turning into cancer. That's why we can extend it. And that's what we want.
And so the HPV testing, it's just during your pelvic exam, right? There's nothing additional the patient has to do, right?
Nothing different, nothing extra. It's the same thing as you're used to from your previous pelvic and pap smear exams with your doctor. So it's just extra testing that we do on our end when we send it to the lab. And the great part is it's more reassurance to know the likelihood of turning into cancer is low if you test negative for both. And then we stop the screening usually at age 65. Again, there's outliers, there's different things, but just remember, age 21 to 65. So that's cervical cancer and cervical screening. I jumped into that first just because it's the youngest age we really start routine screening. I think the most important one, though, is breast cancer and breast screening and breast awareness. You know, this is such a hot topic. In October, I'm flooded with questions with Breast Cancer Awareness Month and women saying, when do I start? Why do I start? Family history, no family history. I keep hearing, if I don't have a family history, I'm fine. And then I have other women that say, well, I hear like you could get breast cancer no matter what. And unfortunately, that's true. So the new thing that I want to convey to patients is clinical breast exams. We used to do them all the time on patients. It's not currently recommended to have a breast exam by your doctor every year. We were finding things that weren't actually scary or life-threatening and causing women to have more screenings done. So what do you need and when? Okay, so we're going to go back to USPSTF, that website I talked about in the beginning. They say to start at age 50 and do it every 2 years. Okay, this is where I absolutely deviate. The American Society of Radiology breast surgeons actually recommend starting at age 40. And they recommend annual exams, annual mammograms. And I absolutely agree with that. And I think that's the way of the future and where we're going to be headed. So currently, all of my patients are recommended to have mammograms starting at age 40 and having them annually. Mammogram, if you haven't had it, think of it as kind of like an X-ray, but it has a lot more views. The breast tissue is put into a machine. I've got a video on TikTok you can follow. It's way scarier sounding than it is, but it's so important, so important. And
yeah, and I can add, I've gotten one myself. I don't know if Dr. Nagori has too. It's really not that bad at all. It's really just, I mean, I have a family history of breast cancer, so I had to get it earlier than 40, but I think ultimately it's not that scary. It's super quick and it's just so reassuring. So don't delay.
Yes. And I love that you mentioned how reassuring it is because it matters. Breast exams that we perform on ourselves or that our physicians perform can miss really early breast cancers that are so small we can't feel them. So saying, well, I don't have any symptoms is not enough. And as you mentioned, with a family history, we often will start even earlier because women are diagnosed. Sometimes I have patients in their 20s and definitely in their 30s who have been diagnosed with breast cancer. So it's so important to meet with your doctor if you have any symptoms or concerns, to have an earlier exam and have them discuss with you if you should have an earlier mammogram. But regardless, even if you feel great, your doctor has no concerns, that screening starting at 40 is what most physicians in this country are now starting to recommend. And because, a very good reason, we want to catch stuff before it spreads. The cool thing about breast cancer, I found this stat out when I was looking at the National Breast Cancer Foundation, 65% of breast cancer is diagnosed before spreading based on our current screening. And that gives you a 5-year survival rate of, guess, 99%. That's incredible. I mean, you're thinking about it, breast cancer is the second leading cause of cancers in the United States for American women, right? Second only to skin cancer. 1 in 8 women in America will be diagnosed with breast cancer in their lifetime. So this is huge. If you miss the screening, it can spread. And when we know that if we catch something early and we can remove that before it spreads to other areas of the body where it's more difficult to treat, your lifespan increases, your health increases, your well-being increases. We want to catch that. So every year, starting at age 40, and technically we don't really stop until you meet certain criteria. Say you're old enough to go skiing in your 70s and you're healthy and you're fit, and if we found cancer, we'd want to still remove it and have surgery, and you do well, we're still going to do that mammogram. Say I have somebody who is, end stage of life in their 60s and wouldn't tolerate a procedure, we stop. So the thing to remember about mammograms is start early, start young, talk with your doctor. She or he will determine a course of how frequently you need to get them, at least every 2, but I recommend every 1, and continuing through your lifetime until your doctor says to stop.
I know that one of my fears before I got my first mammogram was it being painful. I had actually made a bunch of posts. I was really scared that my first mammogram was going to be really painful. And it wasn't comfortable, but it certainly wasn't painful. And I think the most important thing to, I guess, drive home is that even if it is uncomfortable, even if your mammogram is uncomfortable, it's pretty fast. And any kind of cancer that's picked up, I'm pretty sure that anything you would have to do to get that cancer removed is going to be way more uncomfortable than trying to pick up cancer early. And like you said, there's such good rates of survival if it is caught early.
Yeah, and I think that's what makes such a difference. If we did these screenings and there wasn't much we could do afterwards, it'd be kind of futile, right? What we're trying to drive home is when we catch something early, we have such a good chance to get rid of it and increase your health for the next 10, 20, 30, 40, 50 plus decades.
Yeah.
That makes a huge difference. And I get that it's scary. I've had a mammogram. I did not have fun, but you know what? It was worth it. And I think you have to be realistic. None of these tests are amazing, but they're not scary. They will not harm you. And the benefit they have so far out exceeds any risk or concerns or anxieties that you may have. And breast cancer is key. I mean, we have to talk about that in women's health.
Yeah.
Another
See a lot of guys on the chat too, so please tell your wives and your female partners about the importance of getting mammograms, because it's super important. And thank you guys all for joining.
Another one that I'll talk about for screening is colon cancer, since we're talking about men and women's health here. So about 100,000 Americans are going to be diagnosed with colorectal cancer, estimated in 2023, and that's almost split evenly. I think it was like a little higher than 50% in males compared to females. But 1 in 25 women will be diagnosed with colorectal cancer in their lifetime in America. This is coming from the American Cancer Society's estimates. And you can find all of those statistics online as well. I like to pull my stats from sites that are easy to read and pull information in a way that makes it simple to understand. So you can check out the American Cancer Society for more info too. And then I know FemHealth has a lot of great resources. So if you go to femhealthproject.com, you can find stuff. But colorectal cancer is a hot topic. We used to start at age 50 unless you had a family history. Depending on the age of that family member diagnosed, we would go 10 years prior. So say you had someone diagnosed, first degree relative, like a dad with colon cancer at 55, we'd recommend starting at 45, okay? However, recently we have noticed a significant increase in cancer, colorectal cancer, in younger people. And just as of the last couple of years, the new guidelines have switched from everyone starting at age 50, if they have no risk factors, to everyone starting at age 45.
That's a big change, guys. 45. That's a big change.
It's huge. And a lot of my patients are like, dude, I'm not old. I don't need one. Well, I do women's health. Old is one of the worst words you could say in my clinic. So I tell everybody, you're not old. That's why we're doing it. Because younger and younger people are getting diagnosed. And I hate when I hear someone has missed a screening because they were following old recommendations or they didn't know that they needed it. We have to start young on purpose. So these are not aging recommendations. These are updated recommendations because we're seeing a younger and younger pattern of people dying and being diagnosed with colon cancer. We want to catch it early. So typically we'll start with a colonoscopy. Sometimes you can do a stool test kit where it tests for blood. And both of those are really great options. You can talk with your doctor more about what's best for you. The biggest thing, again, though, is getting it done and not waiting. And I hear all the time, I hate that. The prep is terrible. I don't want to do it. Again, circling back to what you both said about the other exams, if they find something, if it spreads, it's going to be a lot more difficult than a simple screening colonoscopy or a stool blood test kit. So we have to do it early. And there's been a lot of talk in the media too about people who have been diagnosed with colorectal cancer earlier. It was a real hot topic last fall. And that's why we're seeing younger people diagnosed. So you don't want to forget your colonoscopies. It's a huge, huge deal.
Agree.
And, I do bone densities too. That one is a little bit different for women's health compared to male health. Generally, I'll follow the United States Preventive Task Force service for that one. We typically start postmenopausally, but usually we'll start around age 65 and go through age 75. I want you to talk to your doctor about that one because those guidelines kind of have fluctuated a little bit more, and your risk factors really, really change if you need that earlier, such as having early menopause, being on certain medicines like thyroid medications or chronic steroids, if you smoke, if you have a pathologic fracture. Pathologic just basically means, why did I break a bone, right? Like I don't have a reason to. So we think, oh my goodness, maybe your bones are thinner. So we'll screen for that. And there's a lot of things that you want to look into for that. But that one is not checking for cancer. That's just checking for weakened bones. But it's also really important because we have medications and treatment options that can help bring that bone health back. Maybe not fully, but get it strong enough to decrease the likelihood of having a broken bone. And as you know, as we age, the last thing we want to do is break a hip, be in rehab for a long time, and have all of the bad stuff that goes along with that and a long healing course. So those are really, really important.
Yeah, and then what are some things that like women, younger women, can do to prevent getting weakened bone density?
Love that question. So two different things. Lifestyle is key. I talk about healthy lifestyle all the time. The biggest thing that you can do is get really good dietary intake of calcium and vitamin D. Vitamin D helps the absorption of calcium. They're like twin sisters. You want them both. You don't want just one. The guidelines currently say you want about 500 milligrams twice a day of calcium if you're premenopausal. Postmenopausal, 600 milligrams twice a day of calcium. Why twice a day? If you take it all at once, your body can't absorb it. And you're just swallowing a vitamin and mineral that you're just going to pee out. You don't want that. So breaking it up is key. But vitamin D is really important. And you want to take it with food. It's a fat-soluble vitamin. And I said fat, which is like the worst F word I can say in a women's health clinic. But fat is good. There are good, healthy fats that we want to focus on. So nutrition is key. Keep that calcium and vitamin D up. And then the other one is exercise. And it has to be weight-bearing. Right? So what does that mean? And against gravity. So if you want to be strong and keep those bones saying, wow, I need to rebuild. I'm feeling this way. I need to keep myself strong. They will sense that when you're against gravity. So as long as you're not swimming, which is great for heart health. But if you do swim, walk. Add jogging. Add something where you're upright so those bones sense that force and they start to say, wow, I'm going to get stronger. I'm going to rebuild. Those are the two best things that you can do. The third best thing is elimination of tobacco products if you're using them. And that's going to help with lung cancer risk as well. That's going to help with reducing your cardiovascular disease risk, which is hugely important in both men and women's health. But a large women are affected by cardiovascular disease. And if we can decrease tobacco intake, that dramatically decreases that risk of things like heart attack and stroke too. So those are the things that I really teach people as far as prevention.
Awesome. Well, that's so helpful, Dr. Erika. I think really everyone learned a ton, and we appreciate your time so much here at Fem Health. Dr. Nagori, you have anything to add?
No, I think these are all really important points. Having got my first mammogram recently definitely was scary, but gotta get it done. And I did not know about the decrease in age to 45, so I have a few more years before I have to get my colonoscopy, but I'm going to do it. So I'm excited, and thank you for providing all that knowledge, Dr. Erika.
Yeah, thank you. I love it. This is what I do every single day, and I live and breathe it, and I want patients to know it is not scary. If you have questions, ask your doctor. Check a ton more information on Fem Health. I mean, you have such wonderful resources. I love working with you. Thank you for having me on today.
Awesome. Thank you. Bye, everyone.
Thanks.